I know that we actually have a question here that I think should be answered by everybody, but we can start with Terri. Terri, I know you had mentioned that you have kids and your family has been very involved in, in your diagnosis and in your treatment course all the way through supporting you. But how do you talk to your kids about this? How do you involve them? Maybe you can give some insight about your experience, and then I'd love to hear how Dr. Luo and Dr. Khalil, how they talk to patients' family members and involve them.
That's a big question. It really is a really big question because the same as every patient's different, every family member is different, and so is like the dynamic within it. And so with my kids, and like I said, my kids are adults, and it's a completely different thing than if I was dealing with a 10-year-old or a 6-year-old. And sadly, that's an awful lot of the cases that people are having those situations. And I can't speak to that because I haven't had any personal experience with it. But it does boil down to the way they understand it and giving them enough information the way that they can process it. My son wanted to drink from the fire hose. He's an engineer. He wanted all the information. Then he wanted to go online and just bury himself in and come up with a solution. Okay, like all of a sudden he's going to become Batman or something. And there was really the solution was online and he was going to find it. He needed that for his way of being able to find the peace. But my daughters needed it in a totally different way. And so I really think it does boil down to sitting down and having that time. And the same as you're not going to get all the information from your doctor, or even if you get the information from your doctor all in one sitting, you can't grasp it all. You need to kind of like be able to marinate on it, and you need to give them the space to do that as well. And a lot of times they're going to ask you the question that's the hardest. And they're like, what are you going to do? And I don't know what I'm going to do. I'm trying to figure it out with the doctor. And this is always during that 2-week limbo time. And so as much as I can't recall who said, kind of find find a normal, there is no sense of normal over those 2 weeks, and just kind of accept the fact that it's not there, but enjoy that piece because right now that is where you are, and be here in the moment and recognize that your family may get mad. They're mad at the cancer. They're not mad at you. And if your family members realize that the patient is mad and frustrated with the cancer, they're not mad with you. And so there's kind of that parts of it, but it still boils down to just the person within the personalized medicine and who's going through the whole treatment.
Totally agree, Terri. I think my approach to how to talk to the family is, first of all, just ask the patient, who do they want to involve from their family, from their patient, from their friend group, from their support group. And with COVID during the pandemic, we had policies that allowed only one family member in the room, and sometimes we're even more strict than that. During that period of time, I think I and many other physicians, we had a lot of family members on like the phone, speakerphone, sometimes multi people conferences on the phone in that visit, and just ask the patient, who do you need to be around you during those visits, especially the first few, where we're trying to kind of get all the information and try to process it. And then who do you want me to reach to if you are not in a situation where you can get all the information, or if you are not in a situation where you can make all the decisions for yourselves, and ask those questions. These are hard questions to ask when you meet a patient and you haven't had that like long-term relationship with them, but it's okay to ask. And they may not have an answer, they might not have a point person, but that's okay. And that just gives them the opportunity to think about these questions and then come back and identify those point people that they want in their circle to be involved with their care and with decision making in case they are not able to do that. And just to have those conversations early on where, okay, what do I do if, I'm not able to make those decisions? And what are my goals besides just treating the cancer? What am I shooting for? Do I care more about quality of life than quantity of life? have those discussions. What are the things that I have to prepare my family and myself and my other life situation to adapt to this new normal? That it's not normal. It's just the new reality of things.
I absolutely agree with, and I really appreciated Terri sharing her perspective and Dr. Khalil's perspective on getting a sense from the patient, which family members and how to engage with them. Two other thoughts I had were a lot of the times going to speak with a social worker can be quite helpful. I think the social workers generally have resources, especially on how to deliver the news to children, and might give patients additional ideas or suggestions. I think it really depends on the age and the maturity of a patient's kids, but I've found that oftentimes, when appropriate, bringing a teenager to an appointment, actually, if possible, given the COVID restrictions, to one of the appointments actually can be helpful, because when they're physically in clinic and they see their parent talking to the medical oncologist, they see what happens during treatment. I think it just physically being at an appointment has helped a lot of kids of patients that I've had. So that's something to consider.